introduction. Cancer Facts and Figures by Cancer.org lists breast cancer as the most frequently diagnosed cancer in women with the exclusion of skin cancers. What is breast cancer? Okay. As you can see here, breast cancer is a group of cancer cells or malignant tumors that begin growing in the cells of the breast. As defined in the picture, you can see that it starts in the milk ducts or lobules and sometimes spreads to the lymph nodes there. My personal experience with breast cancer is taking care of my mother who was diagnosed with stage 3 breast cancer. There are several types of breast cancer, many ways to lower the risk of contracting it, and different treatments to overcome it. When you think of breast cancer, you would never think that there are over 12 types of breast cancer. Okay. The types of breast cancer are divided into 4 different categories, as divided by breastcancer.org, which are non-invasive, invasive, rare, and male breast cancer. Here we see non-invasive, which is ductal carcinoma. It begins in the milk ducts. Then there's the invasive ductal carcinoma, and there are 5 subtypes. And a lobular carcinoma beginning in the lobules. And there are 4 rare types, which only occur in about 1% of all breast cancers. And they're inflammatory, Paget's disease, Phyllodes tumor, and angiocarcinoma. A little bit about male breast cancer there is that even though people think that men don't have breasts, they still have breast tissue, and 1 in 1,000 men will get breast cancer. It's common in older men, those taking hormones with a family history of breast cancer. In a personal interview with breast cancer survivor Yolanda Perez, she shared with me the initial signs and symptoms she experienced, which were lumps and swelling and skin changes. Other symptoms are unexplained change of size or shape of the breast and discharge. You can see the pictures on the bottom. It explains a little bit more. And the staging for breast cancer is 0 through 4, and it's then defined by letters A, B, or C. Basically, it's determined by the size of the tumor and how far it has spread. While breast cancer can be prevented, there are certain things that can be done to reduce the risk. For risk reduction, you could look at screening. Self-examinations are done monthly, and 20% of the time breast cancers are detected by this method. So if you're 20 or over, you should be getting a monthly self-exam. And if you're over 40, it should be done clinically. And if you're under 40, every 3 years. Now for a mammogram, usually recommended over 40, or if you were in a family where there's a history of breast cancer. And a mammogram is pretty simple, just compression between 2 clear plates, and there's either film screen or digital, which digital is connected to the computer and film screen is just black and white. And there's genetic testing, which you can also do, and it just finds the abnormal genes like DRAC1, DRAC2, and PLB2, and those just tell you if you inherited the mutation. And then once you think that you actually do have breast cancer, they send you to do a biopsy, which is diagnostic testing. Basically, it's just a needle that removes the tissue from the area, and then that'll tell you what kind of breast cancer you have and how far along it is. Now, with lifestyle, what are the risk factors? It's published by the American Cancer Society, lists several personal choice decisions as risk factors. Personal choices are like smoking, lack of exercise, unhealthy diet, if you choose to have a heavy alcohol consumption, some exposure to chemicals or oral contraceptives. And other things that are in general, as described by breastcancer.org, what you need to know, published by the CDC, list the following general risk. These things you can't control, obviously: age, family history of cancer, genetics, race, and ethnicity. There isn't one way that cures cancer, but with a combination of several treatments, it can be eliminated and prevented from spreading to other areas of the body and returning to the affected area. So the treatments that there are, first of all, there's surgeries. There's partial mastectomies, which is just the tumor removal. Usually that's with the lower cancers like stage 0 and 1. The higher stages would be like a full mastectomy, which is the entire breast, and of course there's reconstruction to fix that. Sometimes it spreads to the lymph nodes, which are basically under our arm, and then those are removed as well. And ovary removal is recommended due to estrogen production, which can cause cancer to return. Then there's therapy. Chemo, for example, goes directly in the vein, and basically it's drugs to kill cancer. And radiation can be done externally outside the body, or vacuotherapy, basically to tubes inside the breast that does the radiation. And there's hormones, which are basically prescription pills that are drugs to block estrogen. And bone-directed drugs are to strengthen the bones because they're left weak after you've gone under cancer treatment there. By being well informed about the different treatments for breast cancer, women and men can certainly lower the risk of developing. Now, the main points today that we discussed is there's over 12 types of cancer: invasive, non-invasive, rare, and male breast cancer. There's several things you can do for risk reduction: screening, testing, getting your self-exams, mammograms, and also looking at like your genetics. And there's several treatments you could do if you do encounter breast cancer, which are surgeries or different medications, as well as chemo and radiation. Being aware of the different types of breast cancer, risk reduction methods, and informed of all the treatments reduces the chances of getting breast cancer and increases the chances of survival. According to Cancer Facts and Figures published by Cancer.org, 231,840 new cases of invasive breast cancer are estimated for 2015 alone. 29% of cancer-related deaths this year will be due to breast cancer alone, and it is important to stay informed and screen yourself frequently. Thank you.